Congratulations, mama-to-be. You're on the glorious journey of growing new life. As your due date approaches, you may wonder how your baby will arrive through a natural birth or a C section. Both bring your precious one safely into the world, and each path carries its own medical realities and emotional nuances. In this guide, we'll gently explore what vaginal birth and cesarean delivery involve, share real life stories from moms, compare the benefits and considerations of each, and offer practical tips to help you feel informed and empowered as you prepare for the big day. Understanding natural vaginal birth. A vaginal delivery unfolds in 3 stages. First, contractions open your cervix up to 10 centimeters. This dilation phase can last hours or even a full day for first time moms. Next comes the pushing stage, where with each contraction, you guide your baby down the birth canal. Finally, after your baby is born, you deliver the placenta and your uterus gently contracts to minimize bleeding. Pain management options range from breathing techniques and water immersion to an epidural, so you can choose what feels most supportive. Most women stay in the hospital for about 24 to 48 hours after a vaginal birth, and early movement, like walking in the halls, helps speed healing and prevent blood clots. For your baby, passing through the birth canal provides a gentle squeeze that clears lung fluid and exposes them to beneficial bacteria that jumpstart their immune system. Yet, labor can be long and physically demanding. Up to 90% of first time moms experience some perineal tearing that may require stitches, and pelvic floor muscles stretch, sometimes leading to temporary urinary leakage. Story of Lila Layla, age 28, practiced prenatal yoga and deep breathing exercises. After 10 hours of labor with an epidural, she felt her midwife's calm voice guiding each push. Imagine your baby sliding into your arms. When her son emerged, Layla was overwhelmed by relief and pride. Though she had a second-degree tear, gentle walks and pelvic floor exercises helped her recover in under 2 weeks. Understanding cesarean C-section birth. A C-section is a surgical delivery in which an incision is made through the abdomen and uterus. It may be planned ahead if your baby is breech, you're carrying multiples, or you have placenta complications, or performed as an emergency if labor isn't progressing, or baby shows signs of distress. You'll receive spinal or epidural anesthesia, remain awake, and often have your partner by your side. The delivery itself takes minutes, but your hospital stay extends to 3 or 4 days, and full recovery at home spans 4 to 6 weeks. Benefits include avoiding a long labor and ensuring safety in urgent situations. However, surgery carries risks like heavier bleeding, infection, and anesthesia reactions, and the uterine scar often means future C-sections. Story of Emma, 32, learned she had placenta previa at her third trimester ultrasound. Despite her initial fears of major surgery, she trusted her obstetrician's expertise. On the day of her scheduled C-section, Emma's husband held her hand as she heard her daughter's first cry mere moments after the incision. Emma described seeing her baby's face before feeling any tug, a moment of pure love. Though her hospital stay lasted 4 nights and her incision soreness lingered for weeks, Emma felt deep gratitude that the procedure kept them both safe. Comparing pros and considerations. When you consider vaginal birth, the advantages include a shorter hospital stay of 1 to 2 days, faster physical recovery, no major incision to heal, and often immediate skin to skin contact in breastfeeding. Babies born vaginally may have fewer breathing difficulties thanks to the natural clearing of lung fluid, and they benefit from exposure to protective maternal bacteria. On the other hand, vaginal labor can last many hours, be intensely painful, and lead to tearing that requires stitches, as well as temporary pelvic floor weakness. Choosing a C section brings predictability. You'll know exactly when your baby arrives and can be life saving if complications arise. There is less risk of pelvic floor damage and no prolonged pushing. Yet a C section requires a 3 to 4 day hospital stay, and recovery can take 6 weeks or more, with activity restrictions and potential delays in beginning breastfeeding. Surgical risks include wound infection, heavier bleeding, and future placental complications if multiple C sections are performed. Practical tips for deciding first: discuss your personal health status, your blood pressure, uterine history, and baby's position with your obstetrician. Next, prepare emotionally by writing down questions such as what happens if labor stalls, or can I request skin to skin after a C section? A clear, flexible birth plan can ease anxiety. Touring your chosen birth setting and meeting the staff will make the environment feel familiar when labor begins. Pack a two-part hospital bag. Include labor comforts, favorite snacks, soothing music, and C section necessities: loose clothing, abdominal support band. Finally, stay open to adaptation. The ultimate goal is a healthy mom and baby, and sometimes surprises lead to the best outcomes. Whether your baby arrives through the birth canal or via surgery, you share the same beautiful outcome: a safe, healthy mother and child. Understanding both natural birth and C section, weighing their pros and considerations, and preparing thoughtfully will allow you to embrace your birthday with confidence. Trust your body, lean on your care team, and know that you are strong, supported, and capable. You've got this, Mama. Your new adventure begins now. Thank you for watching. If this guide lifted your confidence, please subscribe for more caring insights on your motherhood journey.